Welcome to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Coopersmith, a doctor-prepared nurse practitioner, and this show is about empowering you to live a radiant, healthy, and balanced life. I'm very excited to introduce today's guest, Diane Helm. Diane is a nurse practitioner and the founder of Care First Medical, where she provides primary care and urgent care services. She also offers functional medicine and complementary services such as massage therapy, Reiki, and stem wave therapy. So welcome. Thank you so much for joining me today.
Well, thank you for having me.
Yes, so you and I met on a medical mission with International Medical Relief. It was the summer of 2024, and we went to Peru in the rainforest.
Yes, we did.
Yeah. So that was my first and only to this date mission, and you were experienced. And so I kind of latched onto you to show me the ropes and to see what we needed to do.
Yeah, so it was so nice meeting you in Peru. I'm glad that I did.
Yes.
So, yeah, we're actually getting ready to go to Guatemala here in a couple of months. So, yeah, I love doing the medical mission trips.
That's so exciting. So how did you get involved with medical missions? What inspired you to do that?
So I got inspired to do medical missions because I feel like medical missions it kind of brought me back to why I went into medicine and healthcare in the first place, like just providing care to the community without the overhead of businesses and you have to see the patients in 5 minutes and without insurance. We can just sadly to go out of the country to do it, but go out of the country and just provide good old fashioned medical care to, the people of different countries who are lacking so desperately medical care.
Yeah, it's so rewarding. I didn't know what to expect when we did it. And just everyone was so grateful to have our time and our attention. And it made me feel good to be giving back.
Oh, definitely. It makes you feel so good, especially they're so appreciative and they
Yeah.
will literally, as you saw, people will wait there hours all day
Hours.
long and not complain, just there to get good old fashioned medical care.
Yeah.
It is
Now,
very rewarding.
so rewarding. Now, do you have a favorite story from your medical missions, a favorite experience that just always stands out?
I think probably my favorite experience is my very first medical mission when I went to Guatemala. And I remember being so impressed with when we arrived in the village at our location, there were about 50 residents who some of them had walked for hours to get there. And they were all just sitting there while we were setting up. And they literally sat there for hours. And they were just so appreciative and so happy. And that always stuck with me because, sometimes people aren't that patient, especially when they
Yeah.
go to the doctor and if there's a wait time. I know I don't want to wait,
Right.
as soon as I get in there, I'm
Of
ready to be
course.
seen. I
Yeah.
don't want to wait 5 minutes. So, but I mean, that's their day. They're there to get medical care. And I think that was what impressed me the most is, there's no rushing, there's no complaining. Everybody's just happy to be seen. And, it's very nice. So.
Yeah. And what kind of patients did you see? What kind of things did you treat?
We saw a lot of upper respiratory, a lot
Mhm.
of pain, chronic headaches, a lot of back pain, knee pain, orthopedic pain. A lot of the women in Guatemala, as I'm sure in other countries, they make their own clothes and they make their own things to sell or trade. So they're all very arthritic in their hands. And one other thing that I remember is we have a reading glasses station. And I remember
Yes.
those ladies with those arthritic hands going to the reading glasses and they put those reading glasses on. They're like, oh, like they can see their fingers, like for the first time they can see. And they never knew they couldn't see. And so that always that sticks with me. Reading glasses is, you don't think about reading glasses, but when you can't see,
Right.
and suddenly you have, I mean, I remember people wanting to take them home to their husbands, because most of what we saw as women, because the husbands were working, so they couldn't come, and all the ladies wanted to take reading glasses home, to their husbands, and we're like, no, they have to make sure they're the right prescription. But
Yes.
they were like, oh my gosh, my husband needs to see. So I don't know. I think just the patience that they have, and then seeing those ladies with those arthritic hands, that make their own clothes, and they just don't let it stop them. And then the reading glasses, like seeing the look on someone's face when they can actually see after 20 years of not being able to see.
Right.
So
Something so simple that can be life-changing for them.
so simple, but something that we take for granted, because if we need
Right.
reading glasses, we go to Walmart and we just buy a pair of reading glasses. They can't do that there. But
Mm.
yeah, very simple stuff. And I think that's one thing I like about mission trips too, is they don't take anything for granted. I mean,
Yeah.
they're happy to get a Tylenol. Like when we give them like a week's worth of Tylenol, they're so appreciative. I mean,
Absolutely. One thing that stuck with me, you actually taught me to do a shoulder injection in
oh
Peru.
yeah,
And we had a lot of farmers and manual laborers. And so giving somebody something that maybe will give them 6 months of pain relief, I thought that was so valuable. And I was
yes.
so grateful to be able to do that.
Yes. Yes, it's amazing. And then I think that's, one of the things that they need most, especially the men, because they're out there, they're doing very manual labor. They're not sitting
Yes.
behind desks in other countries working on a computer. I mean, they're out there working, physically, manually working. And so, they do have a lot of musculoskeletal issues. So yeah, the shoulder injection is, life changing. So.
Yes. Yes. So, so cool. So when we met, you were getting ready to open your clinic. So what was the inspiration behind that?
I think really the same inspiration for the medical missions. I have been in large healthcare systems my whole career, and there's that huge overhead. You're limited as to what you can do. You're limited as to how much time you can spend with the patients. They want you in and out in 5 minutes. And I think that really limits the care that we're able to give to patients. So, my inspiration for starting my own business is I really wanted to treat patients the way that I wanted to treat them. I didn't want anybody telling me how long I could spend with the patients. I didn't want anybody telling me how I could treat the patients. I wanted to be able to give them the care that they deserved and take as much time as I needed. And that really was why I wanted to start my own business, because I felt very restricted and limited as to what I could do.
Yeah,
So,
and it's unfortunate that, the medicine has become such a financial thing. And so many, especially people in primary care, there's so much pressure to just see more with less time.
it's
And that
true.
affects our quality.
It does. And I hear from so many people, they say, oh, I tried to get in with my primary care, but I couldn't because they were
Yes.
full. And if your primary care is full and you're sick and you can't get in with your primary, I mean, that's who you should be able to get in with. But that's why we're
Absolutely.
urgent care. So we're here when people can't get in with their primary. So,
Right. So you're urgent care, so things that can't wait, people who have illnesses, but you have a little bit of a twist. So you do things a little
mhm,
different with
we
some functional
do.
medicine. And so what kinds of things are you treating at your clinic?
So in at our clinic, we have primary care, urgent care, and functional medicine. And primary care and urgent care is one business. That's Care First Medical, and then functional medicine is Care First Functional Wellness. So it's a completely separate business,
Oh,
completely separated from the other clinic.
oh, wow. So I think that's so fascinating. Are you able to combine the two modalities even though the businesses are separate?
Um, I do. It's hard for my primary care patients. They do kind of get the benefit of the functional medicine, not in the whole program type of way, but they do get my expertise as far as I want you eating this diet, I want you taking these
Right.
supplements. Um, we don't do a lot of the fancy testing, but we do some advanced testing. We do a lot of advanced cardiac markers on like my primary care patients, and things that insurance is not going to pay for, but that I think it's important in order to
Mhm.
treat primary care. So there is a little bit of overlap, little bit of overlap.
So how do you feel? I think you mentioned, with access, you feel that your clinic is kind of filling that gap for people that can't access traditional medicine. Do you feel that some of the other services you offer are also kind of decreasing the gap in traditional care?
I do. I feel like functional medicine fills a gap.
Yeah.
I don't know if it necessarily fills a gap in traditional medicine because a lot of what functional medicine is not traditional medicine, and unfortunately, insurance doesn't pay for it. So I don't know that it fills a gap in like modern medicine, but I think it definitely fills a gap in healthcare as a whole because a lot of times people's symptoms, are not something that you go to the doctor and you get lab work and they say, oh, this is out of whack. That's why you have so much fatigue, or, this is what's going on. This is why you can't lose weight. So, I think definitely it fills a gap in healthcare and how people feel. A lot of times we deal a lot with hormones, we deal a lot with gut health. And a lot of times in modern medicine, they may do a blood test, check like estrogen levels, and then they'll start people on bioidentical hormones. But how much do we really need? We do a much better job of really looking, at the hormones, at the cortisol levels, and at putting everything together as a whole. When it comes to the hormones, it's like you have your sex hormones, you have your thyroid, and you have your adrenal gland. And I always explain it like it's three golf balls on a server's tray, and once one ball starts rolling, the other two balls are going to roll along with it. You can't have one ball rolling without the other two. So hormones are very linked to each other. When your thyroid is off, chances are your sex hormones or your adrenals are off. When your adrenals are off, your thyroid, your sex hormones might be. They all work together. And unfortunately, in modern medicine, they don't check them all together. They check one and they treat one.
We're going to pause for a break from our sponsor. You're listening to Energize and Revitalize with Dr. Amy. Don't go anywhere. We'll be right back. Welcome back to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Coopersmith, and my guest today is Diane Helm. I think people know the word cortisol, and they know it's a stress hormone. But let's talk about what it is, how you check it, and then what you do to fix it.
Sure. So cortisol, like you said, it's a stress hormone. Comes from the adrenal glands. And when we check it, I like to do urine tests. And when we do the urine test, we check it every few hours. And then when we get the report, we can look at the cortisol trend. So when you wake up in the morning, your cortisol level should go up. And when you go to bed at night, your cortisol level should go down. And unfortunately, what we see sometimes, especially people with chronic fatigue, is when they wake up, their cortisol level is low, and it's low all day long. That's why they have no energy. They're fatigued all day long. And then we have people who have a hard time sleeping at night. And sometimes that's because their cortisol level bumps up right before they're going to bed at night, when it should be low. So instead of being low at night and elevated like it should be during the day, sometimes it's up at night and low during the day, or sometimes it's just low.
So what causes that?
So cortisol is triggered by chronic stress and inflammation, usually. So usually what we'll see is cortisol levels will be very high. And they'll stay high for a while until the body can't compensate anymore, and then they drop. So when we see chronically low cortisol levels, we know at one time they were elevated and the person was very stressed out for it to be as low as it is. So it usually goes up and then it stays up until the body just can't compensate anymore, and then it crashes.
So let's say you find someone who has that low cortisol. What do you do then?
So usually we treat low. Well, first we always like to find out why. That's the big thing in functional medicine is why is the cortisol low? But we do treat cortisol usually with different adaptogens like rhodiola, ashwagandha, reishi mushrooms. Those are very stimulating. So that's how we treat low cortisol levels. We give adaptogens to help bring them up.
So now if somebody, let's say they don't have the testing and they say, oh, I heard ashwagandha is good for you. Will it cause any harm if someone's cortisol is normal and they take that?
All of the adaptogens can have unwanted side effects. So yeah, I mean, if you don't need it, I wouldn't take it. I wouldn't
Yeah,
take it.
I think that's true with anything because even good things can have side effects. And
Hmm.
I know you've probably seen this as well, but I've had people come into my clinic with a bag full of vitamins, and you know, those are all good, but maybe not all necessary for you,
Right. And sometimes you can have, too much of a good thing.
right? And they can interact with each other and or
Hmm.
counteract each other even.
They can, especially like vitamin B6. Like you could be vitamin B6 toxic. And I've
Right.
heard from so many people that say, oh, I was told I can take all my vitamins and what my body doesn't use, I'll just pee out. And I mean, that's true to a certain degree, but I mean, there is such a thing as vitamin detoxes. I mean, you can get toxic on anything. You don't pee everything out.
Right. So more is not necessarily better. That's why they
Right.
need someone like you to kind of help guide the process.
Yes.
So you mentioned chronic fatigue. Are you seeing a lot of that?
Oh, yes. Yes.
Yeah.
Yeah. Probably most people that I do see suffer from chronic fatigue.
And what do you think is causing that?
So sometimes it's thyroid, sometimes it's progesterone levels are low, sometimes sometimes it's the cortisol level is low. When someone complains of chronic fatigue, if they are in functional medicine, cortisol is the first thing I checked. If they are not in functional medicine, unfortunately, a serum cortisol level is not always accurate because that's a moment in time. And like I said, we check cortisol levels kind of all day long to do a trend. So when you just do a one-time cortisol level, it may not be accurate. And the same thing for those 24-hour urine cortisol levels. That's a collection of your urine for 24 hours, but that's not, and it may be perfectly normal, but it also may be perfectly normal if your cortisol is low during the day and elevated at night, like it should not be. In
Right.
24 hours, it may look normal. I mean, when you mix it all up in a red jar, your cortisol might be
Right.
normal.
Right. So even though it's not the most convenient thing to have to collect four different samples, really it's just one day and it's worth it to see
Right.
what's going on.
It's definitely worth it.
Yeah. So are you seeing, I know it's all linked together, but problems with sleep?
Yes, we do see a lot
Yeah.
of problems with sleep. And, usually it's people can't fall asleep, they can't stay asleep, or they're waking up at 3 o'clock in the morning. And a lot of
Mm,
times when we, check their cortisol is spiking at night. If it's not, sometimes at night, we say 1 to 3 a.m. or the liver hours. Sometimes people are struggling to detoxify and their liver is kind of screaming out in the middle of the night, which wakes them up. Also, we have parasites that are more active at night, and sometimes that will wake people up because they'll wake up because they'll wake up to go to the bathroom, or so they think, but really, they may have like an itchy anus, and that's
ah,
sometimes what wakes people up at night, and then they go to the bathroom, and then they go back to bed at night, and then they kind of notice that itch, but they don't really think much about it until you really ask them, when you wake up to go to the bathroom at 3 o'clock in the morning, is your anus itching? And then they're like, oh my gosh, it is. So, and that could,
ah.
be parasites or your liver.
So you mentioned liver as a cause of sleep deprivation, and that's something that's really interesting. So if somebody, a lot of my clients will wake up between 1 and 3, can't get back to sleep. A lot of them also drink alcohol. So do you think that's the cause of maybe the liver struggling a little bit?
I mean, I don't know if the alcohol itself is
Yeah.
is a reason, but it definitely could contribute to it. It could be just that the liver is struggling to detoxify, and of course, we know alcohol, affects the liver, so that certainly could cause the liver issues with detoxifying. That and everything else, all the chemicals that we're
Yes.
ingesting all day long, the plastics that our food are in, all of that. So, basically, everything kind of gets detoxified in the liver. And, if you don't do a liver detox or sweat or, do different things to help detoxify, it kind of gets clumped up in there. And we got to detoxify every now and then.
Yeah. What do you like to do for a liver detox?
So liver detox, I think any good detox, lots of water and, sweating is a good way to
Mm.
detox by going to a sauna, walking after we eat, just helps everything, keep everything moving. And, once everything's moving, it should be detoxifying.
Is there a limit, like a minimal amount of time to spend in the sauna for it to be effective?
Um, I don't know. I wouldn't do more than, like 10 minutes at a time or
Right.
what they recommend.
Yeah.
Like
So
I
you just
wouldn't
want
go
to
in
get
there and
it.
spend extra time trying to detoxify.
It probably depends on the temperature too. I've been
Mhm.
in some where like I couldn't possibly stay in for more than 10 minutes. And then if it's more
Mhm.
mild, maybe.
Yeah. And most places, have like a set protocol that they use for
Yes.
this.
Yes. So it probably depends on the type of device too, I would think.
Hmm.
So you do some other really neat alternative things like Reiki. Um,
Yeah.
so so how do you explain Reiki to, or why would you use Reiki for somebody?
So Reiki is fabulous. So in the body along the spine, there's 7 chakras, and these are energy centers in the body. And when we get sick, when our detoxification pathways are clogged, when we're stressed, those energy pathways can get blocked. And so Reiki uses energy. So I use my hands. Over the client, and my energy interacts with their energy. And what we want to do is kind of open up all those pathways of those chakras, and you know unclog or rebalance the energy pathways, so that people, they feel better. It's good for emotional health, it's good for physical health, it's good for spiritual health. So it's good for feeling better, it's good for stress. So it's an alternative treatment, but it really is good for, medical health.
I think it's so neat that you do that because you can offer people your medical expertise and your training, but you can also say, we can try this different way and see what works best for you.
And most people are open to that.
Yeah. And
Fine.
so you do dry needling as well. So what's
I do.
involved with that process?
So dry needling, we use basically an acupuncture needle. It's a solid, thin needle, and we find trigger points. So usually, anytime someone has muscle tightness, back pain, hip pain, any kind of musculoskeletal pain, we look for a trigger point, which is a very, very tight muscle where the muscle bands are very taut. And we take the needle and we put it directly into that muscle band, and it helps break it up to help it relax. So once we do it, sometimes we'll get like a spasm, and that lets us know that it's working. And then after a dry needling, we want people to drink lots and lots of water, because what holds those muscles really tight a lot of times is those toxins in the muscle. And so once we put the needle in the muscle, we want people to drink lots and lots of water to flush those toxins out of the muscle, out of the body through the urinary system. And then by releasing all those toxins will help keep those muscles nice and relaxed. Because if you don't drink a lot of water and release the toxins, then sometimes those muscles will just tighten back up again.
Yeah, so I think that's a common theme in our conversation is toxins. So
Yeah.
what's going on? Why are we so exposed to toxins? Why are we struggling with that?
We are exposed to so many toxins just in our day-to-day life, in the foods that we eat. Unless we're eating completely organic foods, we're exposed to pesticides, we're exposed to plastics in all of the things that our foods come in. When we put plastic in the microwave, that forms, different toxins that we don't want in our system. Even touching receipts, when you go to Walmart and you get the receipt, all of those things, expose us to toxins. The air that we breathe exposes us to toxins. Our body is constantly being exposed to toxins.
So what do you say to people, or what do you encourage them to do to decrease that exposure, since it's everywhere?
It is everywhere.
Yeah.
Trying not to drink from plastic water bottles, using glass. Don't leave your water bottle in the car in the heat. Don't heat your food up in the microwave. If it's in a plastic container, put it in glass first. Just simple things. When you go to the grocery store, if it says, do you want us a printed receipt, or do you want us to email you a receipt? You want to email the receipt so you don't have to touch it. Just simple things like that. Just trying to avoid those toxic foods and things that we're exposed to on a daily basis.
Now, I saw on your website, you do a little bit of a foot detox. So how does that work?
So it's an ionic foot detox. So what it does is we put an ionizer in the water, and it positively charges the hydrogen ions in the water, and it acts like a magnet. So you put your bare feet in the water, and it acts like a magnet, and it kind of pulls the dead debris and toxins out kind of through your pores with that positive ionizer. So putting a big magnet at your feet and pulling everything from it. And people love it. We have people that say
that sounds fun.
It's great for their eczema. It just makes them just overall feel good.
Well, good. It's so exciting. You have so many things that you do that just help people feel better, like themselves, maybe, if they've lost that. That's a really cool position that you're in.
Yeah, and that's what I wanted when I opened my clinic. Is I didn't just want to be able to prescribe someone a pill.
Yeah.
I wanted to give them the option of the functional medicine if they so chose. And if they didn't choose functional medicine, I wanted to give them other options, for like their musculoskeletal pain, instead of, steroids or pain relievers. Dry needling, you don't have to take any medicine for that, and it's a much more natural way to treat your muscle pain. And Reiki, for stress and for people who are chronically ill all the time, a lot of times those chakra pathways can get blocked up. So, I think it's important to be able to give people, some people just want to take a pill for everything, but other people don't want to take any pills, and they'd rather do dry needling for shoulder pain and, for anxiety, Reiki. We also do meditations once a week, every Wednesday. Tonight, actually, every Wednesday night, we do a meditation. And that's, to relieve that chronic stress. Because a lot of people tell me that they want to meditate, but they don't know how. They try to meditate and, they close their eyes, and 2 minutes later, they're thinking about what they're cooking for dinner. So this is a way for, everybody to sit down, meditate together. You don't have to be perfect at it. You don't have to close your eyes and go into a trance, just kind of relaxing and, kind of getting outside of all that stress. And if you do it every week, then it really does make a difference.
Absolutely. I think just we're such a stressed out society, and that stress does, kind of affect every aspect of our lives.
It does.
So I'm glad you're doing that.
Between the stress and the toxins. Yeah.
Right? But you've got lots for that. So we're just about out of time, but I really want to thank you for joining me today on the show. And so how can people get in touch with you if they want to learn more about you and what you're doing?
So we have 2 websites. We have, so it's www.carefirstmedical.com and www.carefirstfunctionalwellness.com. Or they can reach us at, 276-601-2249 is our phone number. But, we have a website, we have Facebook, so we're out there on social media.
Wonderful. And I see you post a lot, and you're really sharing your knowledge, and so people should check you out just to kind of learn a little bit more.
They should definitely check out our Facebook page. I'll tell you, my nurse, my receptionist are absolutely awesome. And they're the ones that keep all of our social media going. I would not even be here without them.
Our staff. All right, Diane, thank you so much again, and good luck on your trip. And I'm sure we'll see each other soon.
Well, thank you, Dr. Amy. Thank you for having me.
Thanks to our listeners for tuning in to Energize and Revitalize with Dr. Amy. I am excited to announce our 30-day wellness challenge, sponsored by Amethyst Wellness and this podcast. Each day, participants will be given a simple task that is supported by one of our podcast episodes. To learn more and sign up, please visit amethystwellness.com/wellness challenge, or send an email to radiantpodcast2025@gmail.com. Are there topics you would like to hear about? Send me an email. Check out past episodes on Amethyst Wellness YouTube. And we are also featured on Apple Podcasts and all your favorite platforms. Please subscribe and leave a 5-star review with a quick comment. It really helps us reach more listeners just like you. I'll be back next Saturday morning at 7:30 with more expert insights and practical strategies to help you live your healthiest, most energized life. Until then, stay healthy and here's to your best life.